You're not getting better because you're aiming at nothing. Most treatments don't fail because they're wrong. They fail because they never had a clear target. We're not treating a label. We're treating you. And unless you define the goal or goals, you won't hit it. I'm Dr. Sunil Rege, psychiatrist and educator. And this is the one single thing that makes a significant difference for patients in my clinical practice. So in this video, I'm going to show you the one insight that changes everything about how you see treatment, psychiatric or psychological. Because without it, you might end up endlessly tweaking medications and jumping from one therapist to another with no real progress. So here's what we're going to unpack. Why a diagnosis isn't a treatment, what medications and therapy actually target, and how to align treatment with your goals to finally move forward. So let's first explore why diagnosis is not equal to a target. When someone says, I have depression, the next question should be, what part of you isn't functioning? Is it your sleep, your cognition, your ability to feel pleasure, the hedonic drive? We need to know because that's what we treat. If you're treating a label, you're kind of treating this big blob. So let's go deeper into what are the domains of modulation for the clinician. Here's what treatment actually targets: cognition, activity, perception, emotions, impulses, hedonic drive, and sleep. Medications and therapy are tools to modulate these domains, not address a diagnostic code. For clinicians, I use the PACES paradigm: perception, activity, cognition, emotion and reward, and sleep. And I've included this in this 3-hour course on the art of diagnostic formulation. So you can see exactly how this is applied in clinical practice by visiting academy.psychscene.com. But once we understand the domains we need to modulate, we need to break goals down into 2 time frames: short-term and long-term. Short-term focus is on reducing hyperarousal, stabilization of emotions, and improving sleep. Long-term, this is about reinstating routines, rebuilding confidence, and regaining mastery over your environment. Because here's what science tells us. Humans evolved for movement. To think is to move. Emotion comes from the word immovere, to move out. You see, recovery isn't just about feeling better, it's about doing better. And to do better, we must know what does doing actually look like. So if we look at medications, we know that medications target certain constructs. Let me give you an example. Clonidine addresses nightmares and significant vivid dreams that affect REM sleep, leading to REM hyperarousal. Lamotrigine addresses racing thoughts, irritability, and mood dysregulation. Antidepressants can improve cognition and energy levels, but none of them fix everything. We can't expect clonidine to address racing thoughts if they're significant, or to treat psychotic symptoms, or to address mood dysregulation. And there's one surprising thing that's often missed, and that's about how treating psychiatric disorders is like peeling an onion. When you remove one layer, you see the underlying layer. And what do I mean by that? When one domain improves, another may arise. That's not failure, that's feedback. Similarly, when we think about therapy, we've got to think about the right tool at the right time. Therapy is powerful, but only when introduced at the right time. For example, doing deep psychotherapeutic work while someone is sleep deprived and agitated is like trying to build a house when the foundation is muddy or wet or sandy. So therefore, the key message: stabilize first, then build. I just want to feel better is too vague. The real question is, feel better to do what? To work? To parent? To reconnect with others? What does it exactly look like? When we get specific, like I want to wake up earlier, go for walks, talk to people again, then we can target the functions that make that happen. Because the truth is, our feelings emerge from how we act and relate to the world around us. So let me summarize all of this for you. The key message is, if your treatment hasn't worked, it might not be because it's the wrong treatment, but because it's targeting the wrong thing. Start with the end in mind. Set functional goals. Align treatment with those targets. That's when you begin to move. If this video helped you reframe your journey, drop a comment below. Hit the like and subscribe button to stay in touch with future releases. And let me know the one functional goal you're aiming for. I'm Dr. Sunil Rege, and this is Psychiatry Simplified. See you in the next video. Until then, stay curious. Bye-bye.